Okay, this is just a short educational video about MRI studies done for patients who have tailbone pain, and specifically the point of this video is the usefulness of using a vitamin E capsule or tablet or other similar marker at the site where the patient is having pain as a marker when identifying the painful structure on MRI. I am Dr. Patrick Foy, and I'm an MD or medical doctor. Specializing in physical medicine and rehabilitation with subspecialty boards in pain management. And specifically one of my niche areas of treatment is treating patients with coccyx pain or tailbone pain. And my website, for those who want more information, the website is www.tailbonedoctor.com. So back to the point of this educational video. Often when I'm ordering an MRI of the sacrum and coccyx, there are some challenges to getting the appropriate MRI study done properly and interpreted properly. And that's because the far more common than patients having pain down at their tailbone region is that lots and lots of people in the population have pain up in their low back region, up in their lumbar spine or lumbosacral spine. And along those lines, one of the things that becomes important is to get the proper area imaged. So we do this in a number of ways. One is by the order that we write, specifically specifying exactly the type of coccygeal images that we want done, certain sagittal images, T1, T2, etc. I won't bore you with those details in this particular video. But one other point for this video really is the use of a vitamin E capsule, which you can see right here, this circular structure. I'm going to zoom in a little bit more even. Right here where I have the marker pointing at the marker, the vitamin E marker tablet. Basically that circular structure right there is outside of the patient. That is a spot where the patient taped this vitamin E capsule to their skin for the MRI study. And the purpose of that is to help the reading physicians, whether it's the radiologist or the musculoskeletal physician who might be looking at the images, to be able to correlate where the patient is having their pain with where the abnormalities may be present on the MRI study. Because if you think about it, when an MRI is done, I'll go up here. You can see across the top here. These are all the different types of components of the MRI study that were done on this one particular patient for one particular study. So you can see, aside from down to the far right, there'd be scout films, but there are T1 and T2, and these are sagittal. These are groups of sagittal images and axial images, and there are coronal images and stir images. And if you think about it, even just here, these are our T1 images, and you can see from looking right across through here that there are 33 of those. So if you really think about it, then that's just for one of the groups of those images. So literally there are hundreds and hundreds of images, individual images that are done when an MRI scan is taken. So it becomes really important to make sure that the reading physician does not get distracted by other areas and forget to come back and look at the area where the patient is actually having their pain. So for example, in this particular patient, the marker where the patient is having their pain is right here, the vitamin E capsule or tablet taped to the skin right here, and that is right at the area of the upper coccyx or tailbone. And that forces the reading physician to make sure to correlate what is going on there, some wide joint spaces, and actually on sitting versus standing x-rays that we did here in New Jersey, the patient had dynamic instability at those coccygeal joints, so hypermobility, excessive movement at those joints, and we can see then that matches nicely with the area where where she's having her pain when she marked that spot for her MRI as well. And that's important because, just for sake of correlating, up here at the lumbar spine there are some positive findings higher up. but this would be, multiple inches away from the spot where the patient is having most of her pain. This is a patient who actually had a history of lumbar spine surgery, and that was done up at the levels of L4-5 and L5-S1, and up here in the lumbar spine region. And really then, we need to correlate, well, is that what's causing the patient's pain? And really, my impression is that for this particular patient, her tailbone pain is actually coming from the tailbone and from the pathology that we identified there on her sitting versus standing x-rays, and any lumbar pain would be coming from the pathology up at the lumbar spine. In this case, there's a little bit of what's called listhesis, or where the alignment is off at the surgical site where she had a lumbar fusion. So actually it turned out that there was a loose screw in the hardware for her lumbar fusion. But that could easily be a distracting factor, and the treating docs could forget to ever come back to seeing what the MRI showed down here at the tailbone. But that vitamin E marker or capsule helps to sort of bring some of the focus back down to the site where the patient is actually having her worst pain. I'm going to show you if I scroll through. In fact, let me just label the vitamin E capsule right there, that circular dot it looks like in cross section here. And with an MRI now, I'm going to scroll through and show you what we're talking about. There are literally hundreds and hundreds of images. These are slices going essentially from left to right, and here we're coming to the midline where you can see the sacral segments up through here. Sacral segment 1, 2, 3, 4, 5, and then that first bone of the coccyx, which sort of with somewhat of a wide joint space above and below it, and then the lower two coccygeal segments are fused together, and there's a small bone spur down here at the lower tip of the tailbone. So again, all of this would correlate with the site where the patient is having her pain and where she has marked her pain. So that's kind of scrolling through, and you can see how in the other images out here to the side, that vitamin E capsule is not in the window, is not in the picture, because the patient's not having pain, out to the right or left side, but there it is right at the midline, and then it's gone when we come to the other side. Similarly, I'm going to swing over here to a different type of view, but another sagittal or left to right type of view. And again, if you scroll through, it's just one way to help correlate and orient the area where the patient is having the pain. You can see that bright spot, that vitamin E marker showing up very, very nicely there as well. And that's true also when we get to other views here, which is a coronal view for the sacrum. I'm going to scroll through a few of these, and here is the coccyx again on this view. You can see that first bone of the coccyx right here, with a somewhat wide joint space immediately above and below it, and the next two segments fused together there. In this case, the vitamin E capsule is not in this particular view because the vitamin E capsule would be immediately behind this, so it would be not within the plane of this particular slice or image. So that's basically the point that I wanted to make on this video. Is again the use of a vitamin E capsule or tablet for marking the spot when you're having an MRI for patients with coccyx pain or tailbone pain. These videos, just as an FYI, are for educational purposes only. For specific medical treatment, of course, you should speak with your physician or healthcare provider. And for more information, feel free to go to the website, which is, again, www.tailbonedoctor.com. Thank you.